Here we go. My name is Marissa. I am our Senior Admission Counselor and International Admission Liaison at Regis. And I wanted to welcome you all to our Young School of Nursing Virtual Preview Day. Thank you so much for being here this morning and taking some time out of your Saturday to be with us. We're really excited to be able to offer this to you. Today we have our Associate Dean of Pre-Licensure Nursing, Donna Glynn, and we have two of our nursing students, Alexa and Megan. I want to talk a little bit about our nursing program. This is our most popular program at Regis, and we have about a third of our students at Regis are enrolled in the nursing program. We have longstanding relationships with hospitals in Boston and the greater Boston area that we're proud to be able to have our students participate in clinicals in these hospitals. And I will let Donna take it away.
Thank you, Marissa, and welcome. And again, thanks for spending your Saturday morning with us. At this point of your decision, especially for the seniors, you should be thinking now, why Regis? You should be coming down to those final decisions for your schools. And I say that because nursing acceptance is very competitive, and we're going to talk about that today, and I'm going to tell you why I think Regis should be one of your top choices. But before we start the presentation, I'd just like Alexa and then Megan to introduce themselves. Tell us where you're from and tell the people a little bit about yourselves. Alexa, you can go first.
Hi everyone, my name's Alexa. I'm a junior nursing student with a minor in neuroscience here at Regis College. I work at Brigham and Women's Hospital in Boston on an orthopedics floor and a postpartum floor, so that's really fun and exciting. And I also work at an assisted living.
Megan.
Hi everyone, my name is Megan. I'm from Holden, Massachusetts, so out near Worcester, and I mainly work on campus right now.
Perfect, thank you. So let's start talking about why Regis. And here are some of the reasons that I think you should choose Regis. And Marissa, if you could just advance the slides for me, that would be great.
Donna, I don't think I'm able to since you're sharing your screen.
Okay, so we're going to talk today about my faculty that I'm very proud of, clinical lab and our simulation center, the hospital experiences that Marissa already touched upon, our NCLEX pass rate, the resources that Regis offers students in order to be successful on the NCLEX, athletics, which I hope will start again, service trips and study abroad, which I also hope will start again. So first, let's talk about Regis. Regis College, as Marissa said, nursing is the biggest and most popular major at Regis. We have a dedicated faculty. One thing that is unique at Regis is that all of my faculty practice as registered nurses, including this working dean. I am the nurse scientist for the Boston VA healthcare system. I have faculty that work in acute care settings, community settings, critical care settings. Our director of the simulation center works in the critical care setting at the Brigham. So my faculty is bringing my nursing students up-to-date information. We're not sitting there in these ivy towers, not taking care of patients. We're all actively taking care of patients. My faculty is also dedicated to a student-centered approach. And what does that mean? That means that we're actively involved in the learning process. We receive emails constantly. We set up tutoring groups. We set up study sessions for our students in order to succeed. The students who struggle are the ones that don't reach out to the faculty, because the faculty is there to help you through this process. Because nursing school is challenging, but it's not impossible. We have all of the resources there for you. We actively advise our students, and not just which courses to take next semester. Before this started, I was talking with Alexa and Megan about some nursing assistant opportunities. So we're there to advise, not just take this nursing course or take this science course, but also where do you see yourself in nursing? Should you pursue nurse practitioner, doctorate of nursing practice, PhD? So we have these discussions regularly with our students, and all of these discussions are critically important. And the other thing that I just want to add, because of my faculty, we were successful last year at this time during our reaccreditation process. Regis College Young School of Nursing was reaccredited by ACEN, which is a national accreditor, and our program is now fully accredited until the year 2027. Our clinical lab and simulation center is amazing. The clinical lab skills that are so important before you go into the hospitals can be learned, practiced, and reviewed in our clinical lab. And that's so important, because part of the problem is our nursing students are at the Boston hospitals. The Boston hospitals attract critically ill patients, and we want to give you the basics so that you're comfortable going in and caring for these patients. Our clinical lab center we have designated times for each course to go in and to learn the skills. And then we have open labs that are fully staffed by practicing nurses who work with our students on those labs. Our simulation center. So what is the simulation center and why do we use it? We use it so that nursing students can be exposed to critical care situations in a safe environment before they have these patient care emergencies in the hospitals. So we recreate critical care situations in a safe environment. Some examples of our simulations: we do a stop the bleed, which is an active shooter scenario. We do a naloxone overdose in our simulation center. We do a postpartum hemorrhage where we have a mannequin in our simulation center who every semester delivers about 400 or 500 times, okay? So we have a scenario where the mannequin actually has a hemorrhage after the delivery, where our nursing students can learn the appropriate actions to take. We also use our simulation center for some of our behavioral health and psychiatric simulations. One simulation that we do is the nursing students wear a headset one day for a whole day, and they hear voices. They hear what it's like to have schizophrenia and to actually hear voices during the day. So we also have one that's bedside emergencies, where we actually have practicing nurses run these simulations, but we've also brought in some paramedics to work with the nursing students. So it's as close to real as we can get. Now we're going to share this YouTube video with you in the chat room so that you can look at it. But since we can't be on campus, this will give you a glimpse of our clinical lab and resource center. Now, when I went to nursing school back in the dark ages, we did not have mannequins that can talk, vomit, have heart sounds, have breath sounds, have abdominal sounds, make urine, deliver babies. We have all of this in our simulation center. And I think the first time, and Megan or Alexa, jump in, the first time you go in, it just seems so odd to have this plastic person talking to you. But then as you evolve into the actual simulation, it really becomes real. Which ones have you attended so far in simulation?
I know I heard the breath sounds and then I also saw a mannequin blink and that kind of freaked me out, but it was really cool.
Um, they're talking to you. It's in the moment. So it's a great way to learn. And actually these types of simulations started in nursing programs. And now when you have your first job, I can speak for the Brigham has a simulation center where their practicing nurses go and learn advanced cardiac life support and a whole host of simulations. I'm happy to report too that our simulation center just purchased a respirator. So with the COVID and the respiratory decline of the COVID patients, we're now preparing the simulations for our students to participate in a COVID simulation where the patient has respiratory distress. So that's exciting. And I just want to add also when I'm talking about on campus, Regis right now is fully prepared to be on campus in the spring. I just want to tell all of you that although we were remote this semester in the fall and only had about 70 nursing students living on campus, the students were on campus so that they could still participate in clinical. Our clinical rotations have been going along this semester. They actually restarted. We have some programs that go during the summer. It was July 1st that the hospitals reopened to our nursing students, and that has been the case ever since. So why Regis? Boston area hospitals. We use the Longwood Medical. So we're not in downtown Boston, but we've got the next best thing. Every morning we have shuttle buses that bring our nursing students over to the MBTA system where they can then head right into Longwood Medical. We also use community hospitals and community centers. But here's just Brigham and Women's. We have multiple rotations there. Mass General, Newton Wellesley Hospital, Hebrew Rehabilitation Center, Boston Children's Hospital. We have a strong partnership with Boston Children's Hospital. Boston Children's Hospital is actually setting up right now a virtual meeting with our senior nursing students to talk about opportunities after graduation, and that will be the first week in November. We use Metro West Medical Center, Healthcare for the Homeless, the Boston VA Medical Center, Winchester Hospital, Leahy Hospital. We have Regis nursing students pretty much everywhere. And that way we have one of the highest number of clinical hours of any of the hospitals in this area. And I know I love the classroom, but the students would all agree that the clinical component is the best aspect of the program. NCLEX pass rate. So for our traditional undergraduate students, we have a 90% pass rate. That continues to go up, no pressure, Megan and Alexa, that continues to go up because of the resources I'm going to talk about. But we're looking like we're right around a 90 to a 92 for the graduating class. I find out November 1st, and that's very impressive because with COVID, the NCLEX was actually changed. They cut the number of questions questions in order to pass, and our nursing students still did amazing. We do have accelerated master's programs. Those are programs that people already have a bachelor's degree in a non-nursing discipline, and then they come to Regis and they complete their BSN in 16 months, and then they go on to the NP program. For those students, we stand at 100% pass rate. Now, I could have done something really sneaky and merged those numbers, but I'm very transparent. So and anyone can look at pass rates on the Board of Registration of Nursing website. So we're at 90% right now. Stay tuned if you want to check. Probably around December 1st, Bourne will update their website, but I am very proud of our students' accomplishments. So how do we get them there? How do we get them through the dreaded NCLEX? So we have subject competencies. So we use ATI resources. ATI is a platform that every subject has an ATI component of it. The nursing students take more NCLEX style questions than I could ever imagine before they graduate. At the end of the program, they also have a comprehensive review. They have a full week where ATI in normal times comes on campus and reviews everything before they sit for the NCLEX. Because the NCLEX doesn't just do like the critical care the last semester, it goes back and it asks questions from all of the courses throughout our curriculum. So we do a comprehensive review. ATI also provides our nursing students with NCLEX tutors throughout the program, which also helps. And they have a whole host of critical thinking video case studies that the nursing students participate in. So it is a program that our nursing students use starting in sophomore year. Other resources to allow for student success. Regis College obtained a Cummings grant, which gave us originally $100,000 of money to augment our student resources. And then a year and a half ago, we got a sustaining grant. So every year we get an additional $20,000 to $25,000. We put this money into student resources, okay? And what do I mean by that? When students come out of high school, there's something in high school where it's frowned upon if you go to study groups or if you have a tutor. You need to change your thought process on this, because all nursing students should be participating in tutoring sessions, in study groups. And it's just, these are all the tools that are there for you to succeed. We have a student resource center that was sponsored by the Cummings Grant, where there's a private room for nursing students open 24/7, where groups of nursing students can get together, practice exam. There's additional resources in that room as far as online resources, textbooks, whatever they need is there. We also offer tutoring for all of our clinical courses, and students should take advantage of that. We do some faculty development through the Cummings Grant, but the majority of it is student-centered and focused on the students. So just because you look at your schedule as an incoming nursing student and you say, oh, well, I only have like 16 credits, and I'm only in class 2 or 3 days a week. You're only in the lecture part of class 2 or 3 days a week, but it's the other resources that nursing students have to immerse themselves in order to be successful. And we have all of these resources here. Alexa, aren't you a tutor for the sciences?
Yeah, so I tutor statistics and pathophysiology at the Learning Commons.
Nice. And what would you say about the need to seek out tutoring and to participate in study sessions?
I personally love studying with other people. I study with Megan for all of our exams. We're always on Zoom together. And then when we were in person, we were in a classroom together. I study with a bunch of other nursing students as well. I utilize the tutoring services too. Even as a tutor, I still need tutoring for other stuff, but it's like, it's not frowned upon if you're a straight A student and you want tutoring, or if you're not doing so hot and you do want tutoring as well. Tutoring's open for anybody.
Thanks, Alexa. And that's one of the things too. Whether you choose Regis, whether you go someplace else, don't wait until you're in trouble to get help. You know what I mean? Start out with tutoring, with study group sessions, because, and then if you don't need to go as frequently as you are, cut back on it. But the resources are there at all of the colleges. Nursing school is challenging, but doable if you take advantage of the resources. And just before I get to athletics, the other thing I just want to mention is it's kind of tough at Regis to go under the radar. We have a lot of advising platforms and we have a starfish platform. So if you get below an 80 on an exam, your nursing faculty is going to reach out to you to set up an appointment, and they're going to be pretty persistent about it. And you might say, well, an 80 is, 78 is not that bad, but we want to work with you so that you're able to master this content and able to succeed. So it's pretty tough to go under the radar at Regis. So don't be surprised when you see emails from the faculty saying we need to set up a time to meet. And I commend them for staying on top of all of the students. Is it possible to be an athlete and be in nursing school? Absolutely. Okay, absolutely. I think that my athletes are very good at managing their schedules. As they know when papers are due, they know when tests are coming up. So they're very organized. The thing that I ask of my athletes is we actually have an office of clinical coordination, and they work with all of the hospitals to place our nursing students in clinical. I ask that the athletes every semester send an email to the Office of Clinical Coordination just to remind them, I'm a soccer player, and this way we won't assign you to an evening clinical, a 3 to 11 clinical, or a weekend clinical when your games or matches are. But it absolutely is possible to continue in athletics and be in nursing. And not just athletics, I'm going to ask that all of our nursing students become involved in the Regis community. There are a whole host of activities, clubs. I know a lot of the nursing students are involved in the student government, in the Student Nurses Association. They're involved in the dance club. There's so much going on that I think that everyone needs to be part of the Regis community in order to get the most out of the 4 years. And that being said, I want not just the students who are in the residence halls, I also want commuters to become involved in the community, because if you just go have your class and go home, you're not going to get the full experience, and you're not going to be taking advantage of the lab space and the tutoring sessions. So you need to embrace, this isn't, I have a 3-hour class, then I'm done. This is really putting all of the pieces and everything that Regis has to offer in place for your success. Service trips are a huge part of the Regis culture pre-COVID, and I'm very hopeful that they start up again. The service trips that Regis does, right before COVID closed everything down, a group of students, a lot of our nursing students were in Kenya during winter break last year. Appalachia. Alexa, didn't you go to the LA one or Appalachia?
I went to Appalachia and I went to New Orleans.
So, and we go on these, so we build houses, we work in communities. It's just a phenomenal experience. And I would strongly recommend, should you choose Regis, that you look into the service trips. Pretty much everyone before they graduate will do some type of a service trip with Regis. Our study abroad obviously is on hold right now, but study abroad is possible for nursing students. We ask that if you want to study abroad for an entire semester, that you do it in the fall semester of your sophomore year before clinicals start. So if you want to take that full semester and study abroad, which are popular places are, there's a couple in Italy, Florence, Rome, and then we have a lot of nursing students who head over to Australia. That's the semester to do it, and we actually have a study abroad office that works with nursing and to make all of this happen. We've also created abbreviated study abroad opportunities for our nursing students. And what I mean by that is, instead of a full semester away, if you want to have that study abroad experience, we have faculty-led opportunities. 2 years ago, I took a group of nursing students down to Mendoza, Argentina, where we worked at a maternal child nutrition center. So we were there for 3 weeks. So it was a phenomenal opportunity for the students. We went in May. COVID closed us down, but I'm hopeful that that's going to start up again. We also just started a partnership with Ulster University, which is in Northern Ireland, with their School of Nursing. Last fall, nursing students from Ulster came to Regis and participated in our community health nursing, actually went to some of the clinicals with our nursing students. And in the spring, our nursing students were supposed to go over to Ulster to complete their community clinicals in Northern Ireland. That didn't happen. That will absolutely be starting up again once we get the okay from the COVID virus. But those are some of the study abroad experiences that we offer, and we're always looking to expand the study abroad experiences for our students, particularly the 3 to 4 week study abroad options. Okay, Marissa, this slide's yours, the
Yes.
details.
Thank you. Thank you. So a little bit about the admission requirements for our nursing program. First, I want to start off with our early action deadline. This is something I definitely recommend our nursing students applying by. The early action deadline is November 15th. The beauty of this, not only are you getting your application in early, you're getting it read early, but you're also getting a decision and your merit scholarship within about 3 to 4 weeks maximum of your submission date. And given that nursing is such a competitive program, it's better to have your application in before spots eventually are filled before May 1st. In terms of application, we are on the common application. It is a free application.
Can I just add, Marissa,
Yes.
can I just add one thing? I'm sorry to interrupt you.
No worries.
One of the reasons that it's so important that you get this in early is, all nursing programs are governed by the Board of Registration in Nursing in Massachusetts, and we all have a fixed number of nursing students that we can graduate every year. And it's heart-wrenching when I start getting calls in April and May with people who want to come, and the answer has to be no, because we can't go over those numbers. And that's at all schools in Massachusetts. So that's why what Marissa was just talking about is critically important. Sorry, Marissa, go ahead.
No worries. Thank you for adding that. I appreciate it. So we are on the common application. It is a free application. In terms of requirements, there is an essay component, of course, on the application. We require you to send us your official high school transcript. Depending on when you apply, we may ask to see your first quarter or mid-year senior year grades. We require one letter of recommendation that we would like to see from your counselor or teacher. And then due to COVID, for those applying for our fall 2021 semester, our nursing program has become test optional. So you are not going to be penalized for not submitting your test scores, because we understand that a lot of testing sites have had to cancel their exams. So you will not be penalized. In terms of nursing specific requirements, we require a 3.0 recalculated GPA or higher. So recalculated for us means we're looking at just your core courses. So math, science, English, history, foreign language, if you've taken one. Donna, would you just go back? Thank you so much. And then we will weight any courses that are honors, AP, or IB. Those will be weighted, so those will count in your favor should you have taken any of those types of classes. And then because of our test scores being waived this year, we are also looking specifically at your math and science GPA. So when we recalculate those, we'd like to see that to be a 2.7 or higher. And then if you aren't eligible for nursing, we will automatically consider you for your second choice major. But of course, during that process, any questions that come up, your admission counselor and our admission team will be happy to answer any questions along those lines. And next, I think we can take questions. You're more than welcome to put them in the chat, and I can monitor the chat and field it that way. Donna, do you have anything you want to add before we start taking questions?
Megan and Alexa, did I miss anything? Can you just tell people how you decided on Regis?
So I probably looked at every nursing school in the kind of greater Boston. My mom's at a 3-hour radius from home. So I honestly picked Regis for a couple of reasons. First of all, it allows me to have a very balanced life. I'm able to get my schooling done. I'm also able to work on campus. I'm also able to be part of the dance company. I'm taking 3 to 4 classes a week at nighttime. So it really has given me a very balanced school and normal life. And then I also chose it because truly it's like a family. As Dr. Glenn had said, you can't go under the radar. No one's going to miss you, which is a good and bad thing. You can't get out of your classes and stuff like that. But it truly, I never feel like I don't have someone that I can reach out to. And I never feel like I'm lost or a number in a crowd and that no one cares about how I'm doing or how my classes are going and things like that. So I always know that there's someone that I can reach out to. And that is honestly why I chose Regis.
Alexa, anything to add?
I mean, Megan said it all. It's like Regis is a tight-knit community and they will forever be a tight-knit community. I remember walking on campus and my tour guide, Arlene, she's a nursing, or she was a nursing student. She's graduated now and she works as an RN, and she just made me feel so comfortable and at home. And it's just the opportunities that Regis has. And yeah, you don't go under the radar. I know sometimes a teacher may send you a notification, email Starfish and say, oh, hey, come meet with me. I know you're struggling. Or they'll send you an email and say, you're doing so good in the class. And that's always a nice little pick me up as well. You're never under the radar. Everyone's here to support you. And it's just a great family and a great place to be.
Thanks. And as far as after Regis, I can share with you that Regis nursing graduates are sought after. The individuals who graduated in May I know that I already mentioned Boston Children's Hospital is recruiting Regis students. Our nursing students, a group just started at the Boston Medical Center, nurse residency program. We have nursing students at the VA, nurse residency program. Brigham and Women's has hired a whole bunch, Mass General. So our nursing students are very sought after. I don't know of anyone who's struggling to find a job afterwards. They are very much recruited. And I do encourage nursing students to work as nursing assistants. After your sophomore year when you complete your sophomore year, you're able to work as a nursing assistant. And it just provides more opportunity for practice and for those basic skills. And you don't have to complete any type of nursing assistant program. We provide you with documentation that you've completed your first clinical course, because we actually have our nursing students start clinical second semester sophomore year. So you've completed your first clinical course, you've completed skills labs hours, and then the hospitals want you to work there. I never tell nursing students to work like part-time or never full-time, but the hospitals want nursing students and they want Regis nursing students. So what the nursing students do is they work per diem. The hospitals call every month, find out what days they're available. You either have to commit to 2 to 4 days a month, and all nursing students have 2 to 4 days a month available to work those shifts. So it's a great opportunity for the nursing students. And the other thing I just wanted to add, your last semester at Regis, you do a preceptorship. That's a one-on-one nursing clinical with a registered nurse in the greater Boston area. You tell us if you want pediatrics or adult, and then we find the placement for you. And many times that experience is your job interview, because after you've spent the spring semester of your senior year at these hospitals many times reach out to the students and have them then apply there for positions. So I think, did I miss anything, Megan or Alexa? Okay, Marissa, do we have any questions?
We do have a couple questions. The first question we have is, what does a freshman course schedule for nursing students look like?
Alexa, you want it or you want me?
I mean, I could answer it. It's like your basic anatomy and physiology classes. You're going to take a chemistry class. You're going to take an English class. If you have time, you could take a math class. A bunch of courses that are in our 8-semester schedule are very flexible. So you can take a class that you would take in your junior year, your freshman year. So I know I took statistics. That's supposed to be like a junior year course in my freshman year. But your basic prerequisites, so that way you can advance onto the program.
And we also have first year seminar where it's writing. It's really a transition from high school to college course.
Yeah, great, thank you. And so how many nursing students are admitted each year? So we enroll up to 130 nursing students each year. And then the next question was, after submitting your transcript, what if your grades or GPA excel? Will you see second, third, and fourth quarter grades / GPA? We will ask to see your final transcript. So we will see all those grades. And then are any of the buildings?
Can I just add, if you have a semester and it's been very challenging with COVID, with your high schools, with remote learning, it's been very challenging. If you've had some struggles, speak to it in your essay. Make your essay personal. I mean, and I want to see like what's going on. I mean, I remember last year I had one, it was freshman year was a disaster, right? But in the student's essay, she wrote about how she had transitioned from one town to another, and it was a rough adjustment for her. anything like that, speak to that in your essay, because that's what we're looking for.
Great, thank you. And then are any of the buildings on campus open to go to look at? So right now we are not doing campus tours in person, but we do have a drive-through tour that we have made available to prospective students. So if that's something you're interested in doing, you can reach out to me and we can coordinate with campus police, letting them know that you will be doing a drive-through, and we have like a QR code with information that you'll follow during the tour that you do yourself on in your car. So if that's something that's interesting to you, you can absolutely do that. We also do have a virtual tour that you can access on our website to get a closer look at our buildings and what dorms look like, the simulation center, all of those things. And then what is the nursing program retention rate? What percentage of graduates that are offered position at their clinical sites? Donna, do you have that information?
So nursing school retention rate, our retention rate, nursing students are officially accepted into the nursing program the second semester of their sophomore year, because you have to demonstrate that you were successful in the sciences in order to move forward in the program. After, our retention rate is in the high 90s at that point for a couple of reasons. Once you start clinicals in any nursing program, once you start the nursing clinical component of the curriculum, you can't be transferring to other nursing schools. So if nursing is your passion, then once you start those clinicals, all nursing schools have very high retention rates. Okay. And that's why, because you have a definite time when you're officially accepted into the program. And at that point, you start the clinical courses, and no other schools, like I wouldn't accept a clinical course from another nursing program for a student to transfer into ours. So, and I don't really have data as to how many people get offered jobs from their preceptorship. I can tell you right now, the entire May graduates are working. So, I mean, now's a great time to be coming into nursing. There's, my generation is retiring. There's huge need for nursing. The scope of practice at nursing has expanded. I can tell you that as far as data, and I don't think your parents are going to want to hear this, that Regis, at least 70% of Regis graduates go on again for master's or doctoral degrees down the road. We do have a very educated, leadership-focused alumni cohort, and that's the reality of it, and we're very proud of that.
Thank you. Do we have any other questions? I will also put my email in the chat should you do have questions about the admission process, anything like that. You're more than welcome to reach out.
Good. Anything else?
We have one more question. So there are 130 freshmen, but is the senior nursing group the same?
No. And the reason is some people aren't successful in the sciences and don't officially make it to that. People who aren't successful in the sciences, some of them have the option to do it over 5 years instead of 4. Very small numbers I'm talking about right now. And some people, one of the reasons that we start our clinicals in the sophomore year is there are a few nursing students who get to clinical and realize they don't like nursing. So we do it in the sophomore year because then they still have time to pick another major, be it nutrition, be it public health, be it, and still graduate on time. So even though our numbers are very high for retention, there's always a few that aren't successful in the sciences, go with a 5-year plan, or also decide that nursing isn't for them. And one other thing I just want to mention that I didn't, when I advise my nursing students, one thing that Regis offers that's very unique is in your undergraduate education, you're allowed to take up to 3 master's graduate courses. You can fill nursing electives with graduate courses at Regis. And we don't charge more for the graduate level courses. I know most of the juniors and seniors, Megan, I know that you're taking some. It's a great opportunity to chip away at some graduate courses. Alexa, you must be taking, well, you're a neuroscience minor. So it's a great opportunity for people who think they may want to become a nurse practitioner, go into nursing leadership to get graduate courses done while they're still in undergrad.
Thank you. And then we have one more question. How important is demonstrated interest with COVID-19? So I can speak a little bit to this, but given that you are in the health sciences field, I think you would probably be better at this, but Regis has taken it incredibly serious. We have select students right now on campus that have to be there in order to progress in their major. We have testing that is required of every person that is coming on campus. And out of, I don't know, I feel like we've done 1,200 tests. Is that correct?
We're over 2,000.
We're over 2,000. I think we've had 2 positive cases.
And neither were students.
Right.
Neither were students. And let me just say that the deans of the colleges of nursing in Massachusetts meet regularly, and we've made the decision no nursing student will care for a COVID patient. All right, so no nursing students are going to be on the COVID units. We have had, now our nursing students are following the hospital's PPE requirements. The hospitals provide the PPE to our nursing students. We have had nursing students who have taken care of patients who then a day or 2 later test positive. The hospitals notify me, and then I get in touch with the student to notify health services. We are all over this, and we are not going to expose anyone to unsafe situations. With that being said, it's interesting because we're seeing a huge rise right now in individuals interested in becoming nurses. We've seen in our accelerated programs a huge increase in the amount of applicants. So as worrisome as COVID is, we're nurses and we're protecting ourselves, we're protecting our nursing students, and we're committed to that.
Thank you. Any other final questions before we sign off?
Great, thank you all. I will also post my donna.glenn@regiscollege.edu. If you have any questions, I'm happy to answer it. I just want to thank Megan and Alexa again for doing this on Saturday, but please, reach out with any questions to us. I know it's a hard decision. I had 2 children go through college, so it's a hard decision, but we're happy to answer any questions that you have.
Yes, and thank you all so much for coming. And again, please reach out should you have any questions, and enjoy the rest of your Saturday.